First off, let's discuss the meaning of these two types of headaches: cluster and tension headaches, because this will help you to differentiate between the two. Cluster headaches, which are also known as histamine headaches, are sudden, critical, and dangerous. When you have cluster headaches, you generally tend to go through a series of headache spells where some relief moments follow. These type of headaches generally tend to occur on one side of your head. During this period, the recurrence of your headache may differ every day. Sometimes it might just be one headache per day, and sometimes numerous headaches. The suffering you experience during these headaches is very painful. Cluster headaches are highly common between adolescence and middle age, but tend to occur at any age. On the other hand, tension headaches, also known as stress headaches or muscle contractions, are the most popular form of headache. On an obvious note, as the name suggests, the main causes for tension headaches are muscle contractions and stress. More often than not, tension headaches do not bring about vomiting, nausea, or light sensitivity. But unlike cluster headaches, tension headaches will cause you consistent aches instead of a pounding head and generally tend to disturb both sides of the head. Also, tension headaches are very, very consistent and stay around most of the time or even every day. Before we show you the two types of cluster headaches that you need to know. If you're learning and enjoying this video so far, then don't forget to hit the subscribe button. Also, leave a comment saying, "I subscribed," so we can personally reply to your comments. All right, there are two types of cluster headaches, which are episodic and chronic. Episodic cluster headaches are the type that only come in the middle of a week and a year. Once these headaches come, they are followed by a non-headache duration of 1 month or even more. On the other hand, as the name suggests, chronic cluster headaches happen frequently, that is, more than once per year. And just like episodic cluster headaches, chronic cluster headaches are also followed by a non-headache duration that tends to be less than 1 month. Just like we have two types of cluster headaches, we also have two types of tension headaches. They include episodic tension headaches, which occur few times, generally 15 days per month, and also incessant tension headaches, which you can think of as chronic tension headaches. Just like chronic cluster headaches, chronic tension headaches tend to stay for a long time, generally more than 15 days a month. Now that you know your types of headaches, let's see their symptoms. In cluster headaches, you'll experience unexpected headaches at night, which can disturb your sleep heavily. The pain that you get in cluster headaches is a harsh headache pain that travels to your face or around the region of your eyes. Cluster headache will usually disturb you at the same time every day or the same time every year. These cluster headaches can last anywhere from 15 minutes to 3 hours, because these headaches travel down to your face. This is why this particular headache pain can cause you redness in the eyes, cracking on your face, runny or stuffy nose, swollen face and nose, hanging eyelids, and being out of breath. As painful as these symptoms sound, make sure to keep watching, because shortly we will show you the best ways to be free from these headaches. But first, let's see the symptoms of tension headaches. They include aches in your entire head that come and go very rapidly, pain in the back of your head or on top of the eyebrows. People who get tension headaches describe their pain like a constant physical force hitting on their entire head. Other people with tension headaches report that they feel a skull cap or hand-like perception which envelopes their skull, whilst others explain the pain they go through as a muscle stiffness around their neck or shoulder areas. A good way to confirm if your headaches are tension headaches is by observing your pain. This is because the pain you experience can be annoying, but this is the type of pain where you are still able to proceed with your daily functions despite the pain experienced in the process. As with any condition, the best way to treat it is by knowing the major causes behind it. With that being said, what causes cluster headaches? Well, when your blood vessels, which carry blood to your face and brain, begin to expand and stretch out. That's when you will feel the pain from cluster headaches. In particular, for you to get cluster headaches, the trigeminal nerve must stretch and expand, because this nerve is responsible for the sensations from your face to the brain. With that being said, science is still yet to discover why these nerves would expand and stretch out in the first place. Along with expanding blood vessels, if histamine chemicals spreads out in your body, it can also bring about cluster headaches. This is because histamine attacks your allergies and mood. Moving on to the causes of tension headaches. Unlike the causes of cluster headaches, where we had to get a bit technical, the causes of tension headaches are very much straightforward and related to your lifestyle. Even though the specific cause of tension headaches is unknown, but several factors play a big role in the development of this chronic condition. These factors include lack of sleep at night, avoiding or skipping meals, increased and frequent stress, smoking, fatigue, caffeine, or simply not drinking enough water. Along with these lifestyle factors, certain disease can also cause you to have tension headaches. These conditions include flu or cold, sinus infection, eye strain, muscle tension, and anxiety. If you want to find out whether you have cluster or tension headaches, then you need to get diagnosed. So, how can you diagnose cluster headaches? Well, when you meet your doctor, the first thing he will do is to ask you a series of questions that are related to your symptoms. The doctor might also carry out physical and neurologic exams on you, meaning he might scan your brain through MRI or CT scans just to exclude other reasons for a possible headache, such as brain tumor. On the other hand, how can we diagnose tension headaches? Just like cluster headaches, your doctor will diagnose you based on your symptoms. This means that they might ask you questions like, where do you feel pain in your head? Which period do you have headaches? For how long do they terminate? What does your pain or ache feel like? Do your headaches hinder or affect your daily life? Do they hinder you from getting quality sleep? Are you experiencing a lot of stress? Did you have any head injuries in the past? Or did you find out any changes in your behavior? Now, let's discuss the most important part. How can you treat these headaches by yourself? Starting off with 5 ways to treat cluster headaches. Tip number 1. Exercise. Exercise is a no-brainer. This is because it can lessen stress, ease tension, and improve blood circulation. In your break intervals, try to attend a relaxation class, take a walk, or take a long hike, or practice interval training. Research has confirmed that exercise can help you reduce headache symptoms, adding cluster headache relief to the long list of the usefulness of exercising the body regularly. Remedy number 2. Take magnesium. To stop your cluster headaches, take 400 milligrams of magnesium 3 times daily. And since most cluster headaches occur at night, so make sure to take a capsule before going to bed. Not only magnesium supplements, but also eating magnesium-rich foods such as black beans, chard, spinach, avocado, yogurt, pumpkin seeds, and bananas can also be beneficial. Tip number 3. Take vitamin B2. Vitamin B2 can help reduce the harshness and frequency of your cluster headaches. This is because vitamin B2 is an essential vitamin that acts as an antioxidant, helping to strengthen your blood cells and boost your energy levels. A deficiency in vitamin B2 levels can lead to inflammation and cause harm to your nerves, which, as we discussed, can intensify your cluster headaches. A study published in the European Journal of Neurology found that patients who receive 400 milligrams of vitamin B2 capsules daily had fewer headache attacks compared to those that did not. Moving on to health tip number 4. Stick to a regular sleep schedule. People who experience cluster headaches should make sure they schedule their sleep and stick to it. This is because cluster periods may begin when there are changes in your normal sleep pattern. And if you can't sleep, then it could also activate cluster headaches. So make sure you do everything to keep a regular, quality sleep schedule. Final tip for treating cluster headaches. Tip number 5. Try melatonin. Melatonin is a hormone therapy used in patients suffering from cluster headaches. Melatonin is used when patients have tried all traditional treatments, like herbs, and they didn't work. Studies have found that using melatonin hormones can help reduce cluster headache. As such, a deficiency of melatonin can cause you to be more susceptible to headache attacks. But if you find out that you have tension headaches instead of cluster headaches using the methods we showed you before, then as promised, here are 5 ways to treat tension headaches by yourself. Starting off at strategy number 1, restrain the stress you give yourself. We understand it's easier said than done, but you can try some helpful strategies to reduce your stress, such as your plans for the day must be well organized and less stressful. Try to include time to rest and meditate in your daily plans. A massage will also be of great help. We recommend that you find a professional that can do this for you whenever you are available. Tip number 2, give yourself some space. This means find time for breaks and mapping out the time to engage in activities you take pleasure in. Mindfulness can be of great help to some people. This is a type of meditation in which you aim your attention at being aware of what you're observing and feeling in a particular moment without trying to interpret anything. Simply let your thoughts run wild, and most importantly, relax. Tip number 3, drink more water. If your mouth is always dried up and lacks enough water, there's a possibility of you getting a tension headache. So drink as much water as possible every day, even when you don't feel like drinking. You can also try eating foods that are simply rich in water. Whilst we are on the subject of eating good foods, let's check out tip number 4. Always eat foods that contain a balanced diet. Missing or avoiding meals can also result in a throbbing headache. Try to eat at the same time every day, and always add a lot of fruits, whole grains, and vegetables to your diet. And finally, last but not least, tip number 5. Get some exercise every day. We listed this for cluster headaches as well. But exercise is something that's so cliche, yet no one does. Try to do some exercise and warm up every day. You can engage in these for at least 30 minutes, 5 times every week. We recommend that as you exercise, always keep track of your neck, jaw, and shoulders, because these are the common regions where we're likely to maintain a lot of tension. So as you exercise, focus on relaxing these points in particular to help you get rid of tension headaches for good. If you are a true Artistic Remedy fan, then you already know how much we stress that you check everything with your doctor first. If you already knew the difference between these 2 headaches or want to add something we missed out on, then be sure to let us know in comments below. For more videos like this, make sure to subscribe, and we will see you in our next video.